The following is a community affairs presentation from the Ulster County Health Department. This is the Healthy Ulster Radio Show, a weekly presentation exploring community health and sustainability with guests representing a broad spectrum of community partners working to make Ulster County the healthiest in New York State. This program is sponsored by the Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network.
Good morning. You are listening to Healthy Ulster Radio. I am your host, Dr. Carol Smith, Commissioner of Health and Mental Health for Ulster County. With me this morning is my co-host, Ben Mortello, our Director of Community Health Relations. Good morning, Ben.
Good morning, Dr. Smith. How are you today?
Fine, thanks.
Dr. Smith, our listeners know that on Healthy Ulster Radio, we talk about a wide range of community wellness and sustainability issues, from medical treatment all the way through a healthy environment and a whole host of subjects surrounding those. And today's topic is critically important. It's cardiovascular disease, which is the leading cause of premature death and disability in Ulster County. And our guests today are Carolyn Torella from the Hudson Valley American Heart Association. She's the Communications Director, and Danielle Shuka, American Heart Association Corporate Development Director for Go Red for Women. And they're going to tell us about their organization and some of their great initiatives. Welcome, ladies. How are you?
Thank you. Thanks for having us.
Yes. Carolyn, let's start at the beginning. Tell us what the American Heart Association's mission is.
The American Heart Association's mission is building healthier lives free from cardiovascular diseases and stroke. And cardiovascular disease, as you just said, is the number one killer, and stroke is number 5. So we're really tackling a huge amount of health issues across a wide range of demographics, women, men, children, adults, the elderly. So it affects everyone in different ways. And our impact goal for the year 2020 is to improve the health of all Americans by 20% while reducing deaths by 20%. So it's a very heavy lift, and we think we're going to come in very good on reducing deaths by 20% at that 2020 mark, but the improving health of all Americans number is really tough to drive. And so that's why we're here today, to hopefully get Ulster on board with some healthy changes to improve that number.
Sounds great. And can you give us a little bit of background about American Heart Association, how it came into being, and just how extensive it is?
Sure. The American Heart Association is really the nation's oldest and largest voluntary health organization dedicated to heart disease and stroke. So it was founded by some very enthusiastic cardiologists back in 1924, and we really just celebrated our 90th anniversary just a few years ago. So it was really stupendous when you think, I've been with the Heart Association about 10 years on and off, and when you think about and Dr. Smith, you probably know this inside out, how far the treatment of cardiovascular diseases have come just really since the 70s. The dramatic difference in treatments and procedures and medicines, really, which can save lives on a dramatic scale. So when you think way back to 1924, when these doctors were just like, we need to do something, because if you got a heart disease diagnosis, you were pretty much dead. And now we've come so far in that 90 years. And it really is because it's a voluntary organization. We can't do what we do without volunteers. And they really drive a lot of our mission. So we're now 25.5 million volunteers strong across the country. We have over 100 offices across the country. And right here in the 7 counties, we have one hub in Poughkeepsie, which we cover with our staff and volunteers trying to drive the mission in the Hudson Valley to save lives.
Sounds great. And can you give us some examples of some of the work that you do, just to give our listeners a feel for the extent of your work and how you get communities involved?
Sure, thank you. We really do try to make a broad impact strategically across the community. And, like I said, I worked here 10 years, and, back in the day in the 90s, we'd, haul our stuff out to a health fair, and we'd sit at a table, and we'd make an impact on a kind of small, very personal, one-on-one basis. And that's great, because we can make a personal impact with someone that we meet, and we're happy to do that. But the American Heart Association knew that when we have these numbers that are so huge, we can't tackle it little by little. We have to think about strategy and how do we get those numbers driving in the right direction. And it's really by getting organizations involved at the top and buy-in from corporate leaders and community leaders to get things going. So like we would partner with a health department or a CEO at a company and ask and present the mission to them about this is the problem, this is how it's affecting your employees or your community members. Let's see how we can partner together to get these numbers moving in the right direction. And that's really been our strategy for the past 10 years. That's how Go Red for Women came about, and Danielle's going to talk a little bit about that soon. But also just making healthy changes in our own personal lives, but also in the community. So by doing things like having healthy rail trails, making that impact locally, giving people a place that they can exercise, safe streets, playgrounds for kids. So our impact is really strategic in terms of across the community. So we're in hospitals, we're in schools, we're in the halls of government making laws. So it's very we're a little bit everywhere, but we have our volunteers helping us, and we're driving that impact.
And that's very much where the health department is as well, strategically in advancing a prevention agenda and really focused on a whole community approach, realizing that yes, you can take an individual or family outside of the total context in which they live their lives and expect them to get better. So you have to work in the schools, at the places of employment, where people work, live, play, connect with one another.
Right.
All of those things, and the health department was also in the same mode previously, where our community outreach consisted of going to health fairs and handing out brochures, and that's wonderful. But even on your best day, you might reach 100 people, where that's not going to move the needle enough to tackle some of these big complex issues.
Well, certainly then, when you look at what are the drivers of coronary heart disease and diabetes and some of the other major diseases that affect us, very often there are the same basic principles. Tobacco smoking is a major cause of heart disease. If you eat more fruits and vegetables, you're more likely to avoid coronary vascular disease and diabetes and some of the other chronic diseases. Even some moderate activity, as you said, walking on rail trails and getting out and being a little bit more active than we've been used to being. Certainly making sure that your blood pressure and your blood cholesterol are under good control. These are all some basic things that we can all do to try to make an impact on the numbers of cases of heart disease. Just looking at the statistics from the New York State Department of Health, here in Ulster County, we have anywhere between 200 and 300 deaths per year from heart disease. So, certainly that by taking these basic measures, making sure that if you're smoking, that you stop smoking, which is probably, if for smokers, the way to reduce the chances of a second heart attack certainly are to stop smoking, and the first heart attack to begin with, for sure. Exactly. So, these are all messages that really resonate across many different diseases, and that we can, in the health department, that we're trying to get behind and advocate for our community.
And Danielle, tell us about Go Red for Women, if I'm getting that right.
Yep, sure. So our Go Red for Women campaign is this fantastic campaign that we have year-round that really highlights women in heart attack and stroke and recognizing their signs and symptoms, and specifically the things that they can do to stay healthy. So we know when it comes to this disease that 20% of it is some type of family history. So there is always that chance, but there is 80% that is preventable. So again, like you said, eating healthy, reducing stress, getting out and exercising are all these preventative things that we can do. And the message that we get across, or the more that we can get this message across to women, I think the better off they'll be. And hopefully a reduction we'll see from the number one killer of women, to something different in the future.
And we have found that in women, heart disease, heart attacks, et cetera, may have somewhat of a different symptom profile than in men, which I think is very important, certainly for women to recognize.
Absolutely.
And such things as shortness of breath, or a sense of maybe having bad indigestion, unusual fatigue, et cetera, may all be symptoms of an underlying coronary heart disease.
Agreed. And we often hear that women don't, they have these symptoms, but they don't think heart attack. So once we get these symptoms into their heads, then they will stop and think, maybe this indigestion is a little bit more. It doesn't feel quite better from taking this antacid. So what should I do? And having the knowledge will get them to the hospital faster. It won't have... Women tend to put everybody else first, and their health is not always top of mind. So more often, or the more that we can get them to think about these things, the better, and the better off that they'll be.
Generally speaking, how does heart disease, cardiovascular disease with women compare to men? And I know that it's maybe a popular mythology that somehow that cervical cancer and breast cancer are the two major areas concerned for women, and maybe heart disease doesn't get the attention that it deserves.
That's right. Yep. And this is October. It's Breast Cancer Awareness Month, and we know that women are on getting on top of that and making sure they go for their mammographies and their breast exams. But when it comes to heart disease, women aren't doing the prevention side of it. They're not, first of all, they're not aware in great numbers that heart disease is their number one killer. So it's really kind of a hidden enemy. They don't know what to expect. It's coming at them, and they're like, what's happening to me? But we know that heart disease kills 10 times more women than breast cancer. So about 40,000 women die every year from breast cancer. 400,000 women die every year from heart disease. And, I was actually escorted a volunteer to the New York City health show based on TV. And one of the doctors on the show was telling us about, he's a cardiologist, and how many autopsies they'd done on women who had died from cardiovascular disease. And during the autopsy, they found antacids in their stomach. And they had never gone to the hospital because they thought it was a stomach ache, and they didn't do anything about it. So when we hear these numbers and these stories from women, and we hear these stories over and over again where they thought it was indigestion, they just didn't feel right, they had a little neck pain or jaw pain, some pressure squeezing through the back or chest, and they didn't do anything about it, that frightens me, because that means we need to still work on awareness and getting those women thinking about it, but also, and we've come a long way on getting medical professionals aware that when a woman comes to the hospital and she's got presenting with these symptoms, even though she's 30-something or 40-something, that could be a heart attack, and that women aren't, immune from it. It really does affect women of all ages. So that, Go Red for Women also tackles the healthcare side of it as well.
Right. I noticed from your notes that you do some of that work with healthcare providers. That's to right. Education and awareness kind of activities, some of which the Health Department in New York State Department of Health is promoting in other areas, called public health detailing, where members of the public health education teams go in and talk with doctors and practices about some of these things and how to better perhaps keep themselves up to speed with what's available. That's right. And also patients as well.
And through our Get With the Guidelines program with hospital-based quality improvements, and that's science-based evidence and kind of guidelines for treatment across a number of different illnesses with hospitals. And then they apply for kind of recognition of how they're complying with all these procedures. So if someone comes in and presents with chest pain, these are the things that you could do to give the best survival chance for that patient. If they come in with a cardiac arrest or a stroke, cardiac or congestive heart failure, all these things. So the Get With the Guidelines program is really hospital-based, and there are dozens of Hudson Valley hospitals that have been awarded with these awards. So that means we know that Hudson Valley residents are getting the best care based on science and research. So that helps drive the numbers, of course, in the positive survival rate.
And we want to hear more about some of this work right after this short break. We'll be back soon. You're listening to Healthy Ulster Radio.
The excitement continues to build. The mission of Health Alliance is now made even stronger by our new partnership with the Westchester Medical Center Health Network. By combining a legacy of community-based care with WMC Health, we are building a stronger, healthier, and more vibrant community. We'll be collaborating to provide preventive, primary, specialty, and advanced care right here where you live, where we all live. Health Alliance and WMC Health, advancing care here. Visit HAHV.org to learn more.
Welcome back. You are listening to Healthy Ulster Radio. Our special guests today are Carolyn Torella, Hudson Valley American Heart Association Communications Director, and Danielle Shuka, the American Heart Association Corporate Development Director for Go Red for Women. Thank you, ladies, for joining us today.
Thank you.
So, Carolyn, you mentioned when we were discussing prior to the show about some of your terrific advocacy activities that help prevent cardiovascular disease. Why don't you tell us about those?
Great. Thank you for asking that question. Our advocacy efforts really are some of our best work, I think, when we think about making a health impact in a strategic way, because we can't get it done really just little by little in one school at a time, or one corner shop where they're selling tobacco. We have to do it strategically and over a big swath of territory. So that's where advocacy comes into play. And our You're the Cure network, which is our online action network of volunteers, is really that thing that makes it go. It's the engine. So just last year we had an advocacy win of the CPR in Schools law, which basically ensures that every high school student will graduate with hands-only CPR training. And that training consists of watching a video that trains them in hands-only CPR, and then also practicing the skills on a mannequin, and then also getting trained in how to use an AED, which of course is important and vital in the cases of sudden cardiac arrest. So really that's what we're trying to do, is improve survival from that, because there are no warning signs from cardiac arrest. It just, you're fine the 1 minute and you're down the next, and someone has to take action immediately for that victim to survive. So we know that the more people in the community that knows hands-only CPR and have access to AEDs, that they will increase that survival rate, because about 390,000 people die every year from cardiac arrest without symptoms.
Well, we know we have AEDs in all county buildings, and we
Right.
have a Heart Safe Communities program
Exactly.
where we go in and we help employers, big employers, also not only install AEDs but also train their people. And if you're fortunate, well, if you have a heart attack, it's not a fortunate event. But if it happens in a place like Kingston, for instance,
Right.
where the fire department carry everything on board and they're highly trained,
Right.
and they're there in a couple of minutes,
Right.
versus like where I live, where it may take 20 minutes for somebody to get out there.
Right. And that's a problem. And that's why you really need the people, boots on the ground, people, right, your next door neighbor, your friend, your family member, who knows those skills and who can recognize it and take action immediately. And so that's really what this was all about, was trying to get, how do we get that many people trained? And we're like, well, we have schools. It's so simple. They're already learning stuff. We insert it into their health curriculum or their gym curriculum, and they learn it. And so it took 18 years to pass that legislation.
Wow.
Thousands of volunteers. We had lobby days, media pushes, letter writing campaigns, email blasts, and all the parents who had lost children, sadly, to cardiac arrest or family members. But then also the ones who survived, who were able to tell this very impactful story. They were really what drove that law getting passed. So last year's graduating class, which was my daughter's graduated class of 2016, they were the first ones to learn hands-only CPR because of this law. That's about 190,000 students trained last year, assuming all schools, complied. But they don't lose those skills. They have those skills. So when you think about the impact over 5 or 10 years, we're talking about, hundreds of thousands of students now in our community with these skills. And that's going to really save lives. So when we talk to doctors and hospital staff, they love this law, because now that helps them do their job. That means more people are going to be arriving alive for them to save, and
Right.
have a shot at treating them with all their great treatments. So that was I get goosebumps still when I think about how, when we passed, I was in the room when they signed it, and it was a very moving moment with all the families with us. But also a few years ago, we passed the pulse oximetry law, which kind of blew my mind that it wasn't all law already, that when babies are born, one easy measure for finding out if they have congenital heart defects, the number one birth defect, is just to measure their blood oxygen, which is that little clip they put you on your, when you go to the doctor's office, and it measures your oxygen in your blood. It's very simple, but that is a very, and the doctor could talk about it, important diagnosis tool. So inexpensive but it's not a law. So not every hospital or birthing center was using it. And what happens is the babies go home without being identified with these defects and can die at home, sadly. And we did have a mom who lost her daughter in the first 2 weeks. She didn't get that test. So that mom was one of our advocacy volunteers through You're the Cure, and she came up to the lobby days, shared her story on the news, and that law was passed. So we know that's already saving lives of babies, and we're proud. And Connecticut also passed that law too. So these things are strategic and they're impactful at a high level. So when people ask us, where does your local or where does our dollars go when we support American Heart Association and Stroke Association programs, that's really, it makes an impact at a high level, but it trickles down really to our local community and the people who live here. So that's why it's great to work.
And we know that tobacco use plays a huge role in cardiovascular disease, and Ulster County has been very much on the forefront of some of the policy with respect to tobacco use. We prohibited smoking on all county property. We worked with all of the municipalities to prohibit smoking in their parks and playgrounds. Right. We passed a youth tobacco marketing law that prohibits the issuance of new tobacco licenses within 1,000 feet of all K through 12 schools. Thanks to our county executive, Mike Hines' leadership, and Dr. Smith, and all of our community partners, Tobacco Free Action, American Heart, American Cancer. So why don't you delve into that work a little bit and tell us a little bit more about what your role is, not only, in the Hudson Valley area.
Sure. Well, with tobacco programs, like you said, you're on the forefront, and we really do rely, especially for that issue, on our community partners with the Tobacco Free Action Committee and Coalition to get all that work done, because we really do operate on a bare bones minimum staff. So the advocacy director for our region is actually out of Albany. So we do rely on these community partnerships to get that done. So I know they are working on the Tobacco 21 legislation, which we're trying to push county by county right now. And it really is going to ensure that you can't, kids or young people can't buy tobacco until they're 21, until they're really out of that age of the peer pressure and, I think it's cool to smoke kind of age. And then they're adults, and now they can make a decision whether or not they want to, just as adults. And so that's what that is, really to save lives and make the decision later in life.
Well, it's huge because we know that 90% of smokers started before they were 18, and we do know that the brain is still in development from 18 to 21, which lends it to become more susceptible to the fiercely addictive properties of nicotine in tobacco smoke. So certainly if we can make that adjustment from 18 to 21, we would be helping many, many people avoid that addiction that cigarette smoking creates in their lives. So that would be huge.
Exactly.
Accomplishment.
Yep. And we're at the national level as well. We're advocating for more tighter control on e-cigs as well, e-cigarettes, right, because their toxic properties, but also that they're a gateway drug, really, or a gateway tool to tobacco smoking. And I can't believe
nicotine delivery systems is what that is.
Yes.
And the nicotine is the addictive component.
Yep. So that's why. And it shocks me still when I see kids smoking, and they have the marketing everywhere. I was in a little corner shop getting, gas or something, and they had free ones on the counter. I was like, what's that? He's like, it's free. It's a free sample.
Flavors,
tobacco companies.
Bubble gum.
Strawberry shortcake, bubble gum.
Tobacco companies are really behind it. They're spending billions of dollars to hook kids as
making a lot of money.
replacement smokers. Absolutely. And in the guise of that this is a safer or a less addictive habit, and it is not.
Well, that buys right into the history of the tobacco companies. I mean, they sold filtered cigarettes as the healthy choice at one time,
I remember.
Leaving out the fact that they were made from asbestos, of course, and that it didn't really take out any of the carcinogens.
Exactly. And they do, and they market to kids. And if you walk into, we have photos of it on our advocacy page. If you walk into like a tobacco a corner store or whatever, a gas station, that the marketing for tobacco those products are low
at eye
level for kids. So you're not seeing it because you're an adult, but they see it all the time, and that's where all the colorful packaging is. Mm-hmm. So it really is horrible,
Yeah, tobacco.
And they have the money; they're paying billions of dollars.
$2.5 million a day just on marketing, really at point of purchase and on couponing and those kinds of things. And that's without being allowed to be on TV or radio.
Exactly.
Right. So one of the things that's on our bucket list, so to speak, with tobacco is to really work on prohibiting couponing and price promotions, those types of things, and also even to work on, if we can, there's an interesting law in Rockland County that prohibits, we're just at the beginnings of investigating this, but that prohibits smoking in cars when children are present,
right?
Because
I
of
heard
the
that.
effect of secondhand smoke.
Right.
People do have a right, adults do have a right to smoke, but they don't have a right to endanger the health and well-being of a of an individual,
Right.
even if they're their child, who may have no choice. They have to be breathed and they have to be in a closed environment.
And another thing, when you talk about, the cost to the economy of tobacco smoking, the statistics for 2016 basically are estimating that in New York State alone, it is estimated that $22.6 billion will be spent on the issue of cardiovascular disease, the loss of productivity, the medical costs, et cetera, from heart disease. So, if we were to impact the smoking rates and decrease that, therefore decreasing cardiovascular disease, where it's huge savings to just in the financial considerations alone, not to mention, of course, the tremendous loss of lives and disability that
Right.
cardiovascular disease creates.
Exactly, with smoking, and really the shot to the family. I mean, I grew up with two parents who smoked, chain smokers, a 2-pack a day before all the taxes went in, and they suffered at a young age from basically between my two parents had every illness that they say that smoking causes, every one of them, and they suffer physically, but the family suffers as well. It's really a torture to the family to have to
emotionally,
manage that,
financially,
absolutely.
All around.
The toll is really just immeasurable, and it's painful. So if you can spare a family from that kind of pain and illness and toll on the finance, like you say, it really is worth it, any law. So that's really what, You're the Cure is all about, to try and get these laws going, either county by county or town by town or, by the whole state. So we'll take it either way.
And we're glad to have your support because
Absolutely.
we need as much help as we can get.
Right.
Now, why don't you tell us a little bit about some of your exciting events coming up? We know there are quite a few, and we're all looking forward to them. So,
Absolutely. Yeah, well, I think that even on this topic, what the American Heart Association is trying to do is make these generational changes. So while we're not going to, see tobacco go away in the next 10 years, although it would be fantastic, it's about arming people with the knowledge of what they cause, what they do, and, making these changes. And the same goes for when we're talking about eating healthy. We're not asking you to give up everything. We're asking you to make these incremental changes that will lead your family and future generations to making these better choices. So again, this is what we do through Go Red for Women. The women being the CEOs of their family, we like to arm them with the knowledge and the power of making the right decisions, the better decisions, reducing sodium, reducing sugary beverages. We really do the gamut of healthy choices. So what we have going on Friday, October 28th, is our Go Red for Women luncheon. It's at the Grandview in Poughkeepsie, and it is a celebration of the healthy changes that we make throughout the year, a celebration of survivors, a celebration that the survivors are with us, because of the work that we're doing. It's a celebration of our volunteers and all the hard work that they do throughout the year. We have this fantastic program in Dutchess and Ulster County called the Better You program, and it really is a 12-week program that changes lives. It changes your heart health. And then we'll be having the Heart Walk here at SUNY New Paltz on April 2nd, 2017. Stay tuned for that. And to learn about any of the American Heart Association's programs, health info, recipes, CPR trainings, you can visit www.heart.org or call our local office at 845-867-5374. And please join us on social media. We're on Facebook and Instagram, AHA New York, and on Twitter at HV Heart ASSOC.
Thank you for all the great work that you do. It's great to have community partners
Absolutely.
such as
Thank
yourself.
you so much.
Thank you.
Yes.
Thank you.
And we hope to have you back again to update us on progress.
Absolutely.
We expect success. And that's all the time we have for today. Thanks again. You're listening to Healthy Ulster Radio. Tune in next week for more great information on how to keep yourself, your family, and your community healthy and strong. Bye-bye.
You've been listening to the Healthy Ulster Radio Show, a community affairs presentation from the Ulster County Health Department, sponsored by Health Alliance of the Hudson Valley in Kingston, a member of the WMC Health Network. Thanks for listening, and be sure to join us for another edition of the Healthy Ulster Radio Show next week.